Are there natural ways to increase penis size? Folks, this video has no miraculous intent and doesn't aim to promise what it doesn't deliver. In fact, I'm going to identify 5 habits you can adopt in your life to prevent reduction or even increase the length of your genital organ. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health. And now let's move on to the video. Firstly, I would like to emphasize again that there is no miraculous method, and you should not believe in any product advertised on the internet or in the media associated with genital organ enlargement, the penis, because that actually doesn't exist. However, there are some habits that can indeed be taken into consideration, which can help increase or achieve better exposure of your penis, and even prevent reduction in size of your genital organ. The first thing is losing weight. Folks, the penis is an organ fixed to the pubic bone, which is the pelvic bone. When the penis is fixed, it's covered by a fat pad, an adipose cushion. In very obese or overweight patients, the penis can be somewhat buried, meaning it's hidden, giving the impression of a loss in size or even leading some patients to consider they have developed penile atrophy. In reality, the accumulation of fat in this area can make this perception seem true. However, losing weight, slimming down, and especially losing abdominal and pubic fat can lead the patient to better exposure of their penile shaft and thus to an increase in penis length. Another procedure that can be done, which is not natural and involves costs, is liposuction of the pubic area. Many patients, even with weight loss, cannot lose as much fat from this area. In this case, a procedure performed in the operating room is used, which is liposuction with fat removal to better present the penile shaft, and the patient gains 2 to 3 cm of exposure of the body of their penis, giving the impression of increased length. The second way is postectomy, the circumcision surgery. All men are born with excess skin in the foreskin region, and this may or may not be associated with the phimotic ring, with phimosis. Often, the patient has the glans, the head of his penis, completely covered by this skin, giving the impression that its size is smaller than it really is. Patients undergoing circumcision or postectomy have total exposure of the glans, giving the impression that the length of their penis is indeed greater than when it is fully covered with skin. The third habit, and here folks, not allowing the penis to atrophy or shrink, is also a way to increase it, meaning cultivating healthy sexual lifestyle habits and maintaining penile oxygenation. It's important to maintain sexual health and normal size and avoid penile atrophy by combating penile disuse. When we talk about penile disuse, we're not just talking about sexual intercourse itself or masturbation practice. We can also offer the patient pelvic floor physiotherapy related to erectile dysfunction. The use of the vacuum penile pump are vacuum therapy devices that stimulate penile irrigation and blood flow. Furthermore, it's important to make it clear to the patient the total contraindication to the application of non-absorbable substances that promise to increase the girth and thickness of the penis, such as industrial silicone and PMMA. These substances are radically contraindicated for patients who wish to maintain adequate sexual health. A fourth tip is hair removal. Often, excess hair in the base region of the penis can give the false impression that its size is smaller than it actually is. Let me know in the comments if you would like a video dedicated solely to hair removal, with more detailed tips on how to do it. But one example is that it's best not to use a blade. Instead, it's preferable to use electric trimmers or scissors to trim and avoid causing any direct damage to the skin or hair follicle. However, creating this habit of hair removal can indeed give the patient the impression that their penile shaft is larger than when the hair covers the entire base of the penis. And lastly, in fifth place, there are penile extenders. Have you ever heard of penile traction devices? Let me know in the comments if you're familiar with them, have heard of them, or have even used these devices. It's quite common in various cultures, including African and Asian tribes, to practice body structure elongation using traction devices, such as neck elongation or lip stretching. In the case of the penis, it will function similarly. However, these penile devices are specifically designed and customized, needing to be used regularly for a minimum period of 6 months for the patient to often gain a length of up to 1 to 3 centimeters. It's worth emphasizing, folks, that this device should not be used without medical indication or supervision, as it carries the risk of reducing blood flow to the genital region or causing pressure trauma and necrosis of the area. This can lead to serious and permanent conditions contrary to the initial goal of gaining some length through traction. Also, remember, folks, that the penile extender is not a miraculous device, it's a well-established tool. It's also indicated in the treatment of the acute phase of Peyronie's disease, which is penile curvature. It's usually used to try to correct the curvature and also utilized in the post-operative period after surgical correction of Peyronie's disease. So, it's a well-established tool, usually with medical indication, and the pelvic floor physiotherapist who manages this aspect of erectile dysfunction will work alongside the urologist and the patient. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.